case of Mr. Hariharan, the problems were that he was past 80 years of age. He had undergone a bypass surgery in the past. Therefore, there is already a scar on the chest. The anatomy of the structures within the chest wall would be completely different, and he was having a lot of difficulty in walking. Now, such a patient who is elderly has had a surgery in the past are said to have a higher risk for a second open heart surgery. In fact, the second open heart surgery becomes prohibitively high risk in patients who have had a previous bypass surgery, because when the surgeons cut open the chest, they may actually damage the grafts of the previous bypass surgery which they have. Therefore, he was considered to have a high risk for repeat open heart surgery. Then he, after understanding all the risks and benefits of TAVI procedure, chose to undergo a TAVI procedure. In his case, the other complexity which we found was one of his other arteries of the heart had become narrow, and this narrowing was there for a long period of time, and the narrowing had become very hard. So that means we had, in addition to a calcific aortic valve stenosis, we also had a very hard calcific block in one of the arteries of the heart. Now we had a twin problem, that we had to take care of the block of the artery of the heart, as well as we had to clear the aortic valve stenosis. So we decided that we should tackle both the procedures at the same sitting. Therefore, we decided to do the angioplasty with stent placement of the artery of the heart and the TAVI procedure on the same day. So we began with angioplasty, and as we already had proven by CT scan, the artery block was very hard, and it required a special equipment, a drill called as rotablator, to drill through the block, and then we had to place a stent. And subsequently, after this procedure, in the same sitting, we continued on and proceeded to do the TAVI procedure, and replaced his diseased aortic valve with an artificial bioprosthetic valve. Now this is an unusual case where the angioplasty of the heart with the rotablator as well as the TAVI procedure were done in the same sitting. The patient tolerated the procedure very well. There were no complications. He underwent this procedure in about 2 hours and recovered within a day. He was out of the ICU. He was discharged 2 days later, and today he is walking around so much. He could not walk this much in the past 3 or 4 years. So this was a great relief for his symptoms, and his quality of life has improved tremendously. And we also believe that procedures such as these, the procedures like TAVI, also improve the longevity of the patient. His survival duration increases with this kind of procedures.